Our next presenter is Bukola Salami. Bukola Salami is a professor at the Department of Community Health Science at the University of Calgary. She has been involved in over 90 studies totaling around $250 million. She is a nationally and internationally recognized leader in Black people's health and immigrant health, whose work has contributed to the creation of the first mental health clinic for Black Canadians in Western Canada, and the first fully interdisciplinary university-based mentorship program for Black youths in Canada. Welcome to the stage.
Thank you. I should have followed the previous presenter and have one slide. I think I have a bit more. So as was said, I'm Bukola Salami, and I'm Tier 1 Canada Researcher in Black and racialized people's health. I'd like to acknowledge respectfully the land that we are located, the lands of the Squamish Musqueam nations, and I'm grateful for the privilege to present on this land. So we know that we have around 1.5 million Black people in Canada. Black populations are a growing population. It was 3.5 some years ago, 5 years prior. And we also know that we have segmentation in the workforce, which I refer to as the cappuccino effect. Black underneath, white on top, and the need in terms of ensuring equity, diversity, and inclusion by mixing things up. So in the past, I've done several research studies, and I'm just going to pick on a few research projects that I've done on with Black communities in Canada. One of those is we did an interview of, so we started with interviews of Black youth in the province of Alberta. Then we did interviews across Canada with Black youth. The initial one was 30, with 125 youth participating in conversation cafes, and then followed by a national project where we interviewed 50 Black youth across Canada and did a national survey of around 1,000 Black youths across Canada. So here are some of the quotes, and I won't be able to provide all the quotes here, on some of the factors that contribute to the mental health of Black youths. One of those is racism and discrimination. So as one said, God, I hated myself. I wanted to be white so bad. And in another interview, I'm not sure if it was here, she spoke about a girl that she had a day with or a sleepover with, and how she was made fun of. She also spoke about crossing the street and someone throwing a sloppy at her and calling her the N-word. So she continued to internalize these experiences. People also spoke about the lack of Black representation in service delivery and how that negatively contributes to their ability to access mental health services. We did a project, the initial one we did in Alberta was before the COVID-19 pandemic in 2018, 2019. So after the COVID-19 pandemic in 2022-23 was when we did interviews of 50 Black youths across Canada. And we wanted to find out about the impact of the COVID-19 pandemic on the mental health of Black youths in Canada. And one of the things that we quickly realized was the impact of the COVID-19 pandemic was not just concentrated towards the direct effect of the COVID-19, but also the intersecting effects of the Black Lives Matter movement, which was occurring at the same time as COVID-19, and the re-traumatization that occurs from rewatching those experiences. Another, and I'm not presenting all the results here, I'm just presenting a few. Another thing that we uncovered was the impact of sports on Black youth. So one of the youth said, sports is a vector for social change. And this is really our outlet as Black youths to be able to actually address and overcome some of the challenges that we faced. But of course, during the COVID-19, sports venues were closed, and the youths also said bars, in some provinces, bars were open, but sports for kids was closed at the same time. And that had an impact on youth being able to actually address their mental health concerns. We looked at, I guess I don't have okay. So we looked at this graph is about, we analyzed the Canadian Community Health Survey to look at cost-related non-adherence to prescription medications for Black communities. And this was the one in 2019. So if you look there, you'll find that there's significant difference between, first, we wanted to look at Black versus white disparities. And when we looked at Black versus white disparities, we found that there was significant differences in cost-related non-adherence to medications between Black and white. And then we decided, let's see what other racial groups also looks like in comparison, comparing other racial groups. And we found that there were differences across all racial groups, but Black people had one of the highest cost-related non-adherence. Another project that we've done in the past is using, again, the Canadian Community Health Survey, which is the most widely used survey of Canadians by Statistics Canada, related to health. We looked at pap smear and mammogram screening among Black people. And we compared, again, Black versus white, and we found significant differences, especially in pap smear screening between Black versus non-Black Canadians. I would say, we did, take it one step further and look across racial groups. If there was significant differences in pap smear screening, which is an indicator, is a risk factor we looked across different racial groups, and we found that actually South Asian and West Asians, so Afghanistan and South Asians had the highest level of lower screening rate for pap smear. I also wanted to point to this. When I did speak before and I talked about Black, the healthcare profession is like a cappuccino, Black underneath, white on top, and they need to stir it up. It wasn't as much of a concern until we had COVID-19 pandemic, and then we realized that yes, Black people, I'm over time. Black people had the highest rate of infection from COVID-19 pandemic. And when we started doing some research to look at how to address COVID-19 vaccine hesitancy among Black population, and one of the things that really jumped out was issues related to trust and mistrust. We recently received a Cheffe partnership grant of $2.5 million to transform the lives of Black children and youth in Canada by addressing their overrepresentation in the justice system, child welfare system, issues related to settlement, and their educational system. And that is the mentorship program that I created 5 years ago. I am a product also of the University of Toronto Summer Mentorship Program 25 years ago. And I created one in Western Canada to see how we can transform and improve the lives of Black communities in Canada. So one of the things as part of our Cheffe partnership project is we're also going to be putting together a summer institute for Black early career researchers, and that will be happening in May. And we also have other projects going on, including a comprehensive review of the literature and the national survey of Black children and youths in Canada. Thank you, and sorry.